This meeting is being recorded.
Hello, Health Journey Heroes. This is Beth Black from Lose Sickness, Spine Wellness. Our podcasts are about getting to the root causes of health challenges. While we tend to focus on eating well, exercising, and supplementing intelligently, there are so many more aspects to optimal health. As you already know, that's why you're here. Our goal is to introduce you to some of those who are on the front lines with us of this journey, because it is a journey, while having lots of fun along the way. It's all about learning and getting educated. If you are someone or know someone on a health journey, please like, share, and subscribe below, and let's get started. Thank you, Dr. Tarantola, for joining us here today. I am so excited to be able to be here with you in this format, because normally I am sitting in a chair like that. Dr. Tarantola is actually my holistic dentist out of St. Augustine, Florida. I'm so grateful I found you. Quite honestly, I was searching when I moved back to Florida to a different sector from where I lived for many years. And when I moved back, I was like searching for a holistic dentist. I've been using holistic dentistry for many years because somebody told me about it many years ago in my health journey. And so I really want to be able to bring you to our audience and help reach other people, because I think it's so important for people to understand that there's a difference between what we've been taught as traditional dentistry versus what holistic offers. And it's so important because there's a lot of people who are looking for clean, healthy living, and holistic dentistry is a piece of that. It's a very important piece because, quite honestly, everything we put in our mouth, from breathing to water to foods to everything, and I always say, it's a journey through the body from beginning to end, if you know what I mean. And we're supposed to absorb all the great stuff and get rid of all of the bad stuff. But a lot can get caught in here. And it's so important to the health of our overall body. And it all starts in the oral cavity. So, Dr. Tarantola, I'm going to ask you first and foremost, before we get into who you are, because I want to dive into your story a little bit. Could you tell our audience really what is holistic dentistry, that in lay terms that they can understand? You don't need to go into all the medical terminology, but what is holistic dentistry to you? How do you explain it to people?
Okay. First of all, thank you, Beth, for having me be part of this podcast. Really appreciate it. That question I get quite often from patients. And basically, I think there's probably three things that really set holistic dentistry apart. The first one is, it's very personalized. It's a personalized one-on-one approach. Whenever I see a new patient, the first thing we do is I sit down with that patient before any kind of procedures or x-rays or diagnostics are done. I review their medical and dental history. I make sure I understand everything that they put down on that form, ask questions, continue the conversation. Want to get a sense of what their expectations are. Their medical history is very important. What's happening with them medically has a lot to do with what I might see in their mouth, with their teeth, with their gums, and vice versa. What I see in their mouth with teeth, gums, that kind of thing may be a contributing factor in what's going on with them medically. So, holistic is kind of looking at the whole person, the whole body, the mouth, not as a separate entity, but as part of the whole. The second thing I think is the big difference is when it comes to fixing teeth, we try to do it in the most conservative way possible so that it's kind to that living pulp of the tooth. The tooth has a blood supply. It's a living entity. And if the procedures get too aggressive, just like with anything to our body, it can do sometimes irreversible damage. A lot of patients, when they think of a holistic dentist, think, well, they don't fix teeth like traditional dentists do, but that's really not the case. Sometimes things do need to be fixed. And the analogy I give patients is, imagine you had a hole in your roof of your house. You could use all these wonderful natural products to clean the mess from the hole in your roof, but you're eventually going to need to fix the hole in the roof. And when that time comes, you don't have to rebuild the house. You may not have to redo the whole roof, but you want to address that particular problem and do it in the most conservative way possible. And the other thing too is when you do conservative dentistry, it requires a lot of time and attention to every little detail. So I personally, do every aspect of the procedure myself. I don't delegate it to staff members. We allow plenty of time, so we're not rushing through procedures. Dentistry is a profession of many tiny little details. And if any of those little details are rushed through or overlooked or not paid 100% attention to, it can affect the final result. And I think the third big thing is we're always looking for more natural products. We try not to use chemicals. For example, for pain management, we use things like Arnica montana, quercetin and bromelain. For antibacterial, we use colloidal silver. We use ozonated water. For inflammation control, I love using the low-level laser. And when it comes to protecting the teeth, we use natural products like hydroxyapatite, calcium carbonate. In fact, every patient gets a copy of our remineralization protocol. And the whole purpose of it is to nourish teeth, internally and externally. Externally meaning brushing your teeth, internally meaning through your nutrition. A lot of people don't really understand that teeth have a blood supply. So, what you take in nutrition wise gets into that living pulp of the teeth. And the other part of the remineralization protocol is minimizing the bad bacteria, the bad teeth bacteria, the bad gum bacteria, with all natural products. So I think those are the three main things that I see as what sets holistic dentistry apart.
I love this. That was so simple. And because, you all know that our mantra is eat well, exercise, and supplement intelligently. And that's exactly what you're talking about. It all starts with, what are we putting in our mouths, eating well, but also taking care of that oral cavity, like you said, externally by brushing teeth and doing the flossing and things like that we need to do on a regular basis. But what we're putting in affects that. And so it's so important to be able to look at all those pieces. And I love this because holistic to me, I'm an occupational therapist, and to me, holistic is taking care of the whole person, the whole body. And when I go to a holistic professional, I'm looking, and as a matter of fact, it's interesting because we kind of met at the beginning of quote unquote this pandemic. We met at the very beginning of it. And I actually remember when I reached out to you, we didn't even know there was anything happening yet. And I had booked a time to come in and have a conversation with you because, again, you guys, I think it's all about that we are interviewing these professionals because I'm hiring you to work on me, to help me get everything in order. And I love that. Again, I say we interview you because you turned around and said the first thing you do is interview your patient. And so what happened is we had to meet via Zoom or FaceTime. I think we tried Zoom and then it wasn't working and we did FaceTime, whatever. We ended up talking by phone, face to face.
I remember that well, yeah.
And it was about getting to know, you were trying to get to know me, but I was trying to get to know you as well to make sure, is this a connection? Is it a fit? Because I think in holistic practicing, it's so important that you have a fit with the environment where you're going and the practitioner. And I absolutely fell in love with the fact that you were all about doing and delivering exactly what the patient needed. But it wasn't about you telling me what to do. It was about a conversation.
Yep.
And that's what you're all about. You're all about, and I love the fact that you are 100% all in that you said that you deliver what is needed. You're not looking to offset that to somebody else and say, you do this, you do this. No, you come in and you actually look at everything and you discuss it with the patient. And I know that because I'm not the only patient that I've referred to you. So I know that there's other people that are coming and they're getting the same experience I am.
Yeah.
And that's what holistic should be. It should be a collaboration. you are the professional giving the guidance, but I should be able to collaborate with you and say, this is what I'm doing. This is what I'd like, not like, whatever, so that we're working together on a protocol or a plan. And you do that at every single step of the game.
Yeah.
I love that.
Yeah, I always tell patients, I never want them to move forward with any dental procedure just because I said so. I mean, that's the absolute wrong reason. I want them to move forward with whatever we're recommending because we've had the conversation. I've presented the information to them in an understandable way. I've given them time to make the decision. I don't want anybody to make a decision right there on the spot. So that, after they've contemplated all this, they feel like, they're making a decision that's in their best interest, not just because I recommended it.
I love it. I love it. And so if you're sitting here listening to this and you're just being educated on holistic dentistry, I want to recommend, even if you're not within range to be able to see Dr. Tarantola, make sure you're taking all this information and utilizing this as you look. So Dr. Tarantola, if I could ask you, actually, we'll get to that question at the end. Let me save that question at the end. I want to get into it, my own experience of being in the holistic fields for my own self naturally for the last almost 30 years now. We all have a story. I always say, what's your story, Morning Glory? Because we all have a story. We didn't just end up in this industry of holistic alternative practices just by accident. So can you share with everyone, like whatever you want to share, what drove you to go from traditional dentistry, if you were in fact a traditional dentist to start, I'm not sure. What drove you to go to holistic dentistry? Like, what's that story behind everything that you're doing today?
Be happy to share that with you. Well, I've been a dentist 40 years. This year is 40 years.
Wow. And
for the first 20 years plus, I probably was a traditional dentist. And by traditional dentistry, I mean, doing crowns, doing bridges, taking care of patients' bite, gum treatments, that kind of thing. We decided to move to the Jacksonville area in 2008. And I associated with the dentist, actually bought his practice, who was a holistic dentist. I've always heard of holistic dentistry. And again, being a traditional dentist, you think of it as kind of something, way off the cuff. It's not something, voodoo. There you go. So, as I got to know, and he was a Chinese dentist. So, they kind of have that holistic orientation anyway. And his practice was focused on holistic dentistry. So that kind of really opened up my eyes. I saw how he did things, that was still doing dentistry, but in a way that was more holistically oriented. And I said, there's just a lot of benefit of this for patients. And the other thing I saw happening too is, as you're in practice longer and longer, and you see patients, that have had a lot of dentistry done, you see a lot of times their problems are because of dentistry. Kind of over treatment. And I says, well, are we really doing our patients a service for the long run? So it kind of got me, thinking about maybe we should be more conservative and not too aggressive with treatment. We could have this conversation about medical too. How traditional Western medicine, it's about the procedure. It's about what can we prescribe you, and just like medicine, a lot of dentistry is turning into corporate. Corporations are buying practices, and a corporation's main goal is profit. And we are a business, we have to make a profit, but that can't be your main motivation. And we see a lot of patients coming in, that have gone to these practices, and they said it was just a very unpersonalized approach. They felt like a number, where the dentist was just going from chair to chair. And after maybe a 5-minute, 10-minute examination, they were ushered into a room with the financial person and given a treatment plan and kind of forced to make a decision, right on the spot. And I says, this not only is this not how you do dentistry, it's just not how you treat people. it's in any business, but especially in the health business. So I just, tried to learn more and more about this approach. One of the organizations that I learned a lot from was the IAOMT, International Academy of Oral and Dental Medicine. That's where I developed a protocol for taking silver mercury out safely, in a way that's safe not only for the patient, but for us, the doctor and the assistant. And the other thing that makes it, I think, for me, so much easier is my wife is my dental assistant. So we work side by side every single day. And the thing that makes me the happiest is, during a procedure or after a procedure, the patient will look at us and say, "I've never seen two people work so well together." and that too has added a lot of joy to the practice of dentistry for me.
That says a lot. And I know this because my husband and I work side by side together as well. When he left the corporate world many, many years ago to join me in business, it does take a special couple or relationship to be able to do that. Not everyone can do that. So I love that. And you two, just like us, you kind of, you just dance well together. I don't know how else to put it. You dance well together, and it's a beautiful thing. And we love Cheryl. We love that Cheryl's always there and covering everything for you. And that's the thing, when you have that relationship, which I think makes your practice so special, is because you are on the same page. You are not just coming from this hierarchy of I'm being told this is what I have to do from a corporate standpoint. You are truly, it's so obvious when you walk in your office that you are all coming from your heart. You are, and I always say you're serving society. That is how everything should be, in my opinion, is we should be serving. But what happens is we've served these higher entities for so long that we think that we should just walk in and we should, we're a number. And a lot of people are getting frustrated with that, as you said. So here's a question, like, where do you think, like, when your patients are coming in, what do you hear from some of your patients? I mean, you just shared that they feel like a number. They feel like they're being tried to, sign here and go on this payment plan or whatever. What brings people to you? I mean, do they know you're a holistic dentist when they come there? Or do they just move to the area and they happen to fall in there and go, "Oh, this is different"? Like, what's bringing people to you? And the reason I'm asking that is because I have been doing this for 30 years, but I learned actually from my holistic health professional 30 years ago, who recommended that I go to a holistic dentist. And I went, "What is that?" And she started telling me what that was. And then, of course, my next question was, "And who and where do I find this person?" And she referred me to somebody where we were living at the time. And then when I left there, I honestly was like, "Oh my gosh, like I'm never going to have another holistic dentist. Like, where am I going to find another one?" So one of the questions I'd love for you to answer for people is, how do you find a holistic dentist? Because I know how I went about it. And I was very fortunate in my searches when I moved to the state of Georgia, as well as when I moved back to Florida to a different area. I've had 3 wonderful holistic dentists in my life over the 30 years. And so what are people looking for? What are people saying? And how do you serve them if they're not in your area? Like, what would tell people?
Yeah, I think the way it starts is a lot of times patients are seeking out a holistic lifestyle. They're really not thinking about dentistry, I think, as they're first trying to learn about what it means to be holistic. I think they're disillusioned many times with the medical profession. Like I said before, what procedure can we give you? What pharmacology can we prescribe? And I think people are getting kind of tired and frustrated with that. So they kind of research on their own, what a more holistic lifestyle is, how to, nutrition, exercise, being active, that kind of thing. And, in their research and in their journey, they may see something about holistic dentistry. And I've had so many patients say, "Well, I didn't even know there was such a thing. But, you know, in my journey for looking for a more holistic lifestyle, I came across holistic dentistry. And they says, huh, that's interesting. You know, I think that if I want to live a holistic lifestyle, that's going to be a very important aspect of it. So then they research holistic dentistry, and you know, most patients find us. They do a Google search, you know, for holistic dentistry, and we'll come up. That's a percentage of it. A lot of it, most of it, is referrals from other patients. You know, our website is not a generic website. It's a custom made website, and I think it really reflects, you know, who we are and what we're about. And you know, my goal for my website, you know, was for the patients that are doing the research, that they know all about me and my practice before they ever come in. You know, that's what I want the website to help them learn and understand. And it's nice when patients come in and say, you know, what I saw about you on your website is really true. It wasn't just a marketing thing, you know. So, and that makes you feel good too. And I think it's just people today want to take control of their health. You know, they want to be the purveyors of their health and their lifestyle and their longevity. And as a result, we have patients coming from great distances. I mean, South Florida, South Georgia, you know, the Panhandle. You know, when patients feel, you know, like you're somebody that's going to connect with them and help them in a way that they hope to be treated, you know, the distance obviously is something they take into consideration, but it's not the only determining factor. So.
Well, I always say people don't care how much you know until they know how much you care. So, yeah, I mean, once they get in there, they care how you take care of them in terms of the results and the solutions. But the thing is, I think we all, it's just human nature. We want to be cared for. We want to feel that caring sense that it's not just, you know, get this done to you and pay the bill and walk out the door. It's a sense of we are going to actually work to improve or upgrade your health through your dentistry. I mean, let's face it, it is the beginning of everything. It's where everything goes in, and it's connected to very close to the mindset as well. I mean, it's all like, it's all there. Yeah. And then it starts to filter down to the rest of the body. So it's a pretty important place.
Yep, very important.
So in closing, what would be, like, if somebody was to do a search looking for a holistic dentist, what are some other terms possibly they could look for if they were searching to find somebody in their area? Like, I know holistic, some other terms possibly?
Yeah, biological dentistry is another one, alternative dentistry. Holistic and biological are probably the two main descriptive terms.
And would you agree that when they do that, they really need to set up, like if it's a good holistic dentist, a good biological dentist, that dentist would most likely be willing to do some type of informational exchange or interview, whatever you want to call it, or they might also be offering educational classes that you could join in and learn a little bit about them. Get a feel, because I know for myself, I actually found another one in North Florida when I moved here, but once I started doing my research, I realized it was not what they were putting on out to their message was not who they really were.
Right.
And that's why when I met you, we had a conversation, and then I was like, wow, he's talking my language. Like, this is somebody I definitely want to go visit. Yeah. And I did. I went and visited you. And although those were interesting days at the beginning when we got to reopen your business and I showed up for the first time, it was not my typical dentistry experience, nor yours.
Yeah, I remember that conversation well. It was right in the middle of the lockdown. We had to, yeah.
It was crazy. But here we are 2.5, almost 3 years later. And I just want to thank you for everything you do. And I would just tell everyone, put your questions below, because we will make sure that we get those answered. We will make sure you get connected. Go below for the website for Dr. Tarantola. It's Tarantola Dentistry out of St. Augustine, Florida. I think we could probably expand upon this conversation. There's so many things to talk about of what goes on in that oral cavity, and what we could do. I mean, you threw out a lot of different names of holistic things that we use, and I know that a lot of people, some people have heard of them and some people have not. So we might want to, I don't know if you would consider coming back, but maybe come back and do something to dive in a little bit more to some of these natural ways that we can deal with our oral cavity.
No, I think that would be great. You know, we could talk about what are some of the common problems I see, you know, what are the causes of these problems, and how holistic dentistry can really help solve these in a better, long-lasting, healthier way.
Beautiful.
Sure.
Beautiful. Well, I'm going to ask you, do you have any closing thoughts that you'd like to leave everyone with before we exit today?
Other than just thanking you very much for this opportunity. You know, I always look for opportunities to spread the word because it's in our patients' best interest. And again, thank you for this.
Well, you're welcome. And honestly, the reason we do this is because, let's face it, we are not owned by big corporations, and therefore we don't have somebody giving us money for marketing. How do we do that? And you said it at the beginning, word of mouth. Asking people, who do you know, make referrals. Here's the thing. If you are jumping into a holistic lifestyle, I'm going to tell you, go to the circle around you and ask, who do you go to for this? Who do you go to for that? Start asking, because Dr. Tarantola has actually connected me to other people in our area because I was looking to create my community. And he happened to be one of the first ones I met. So ask around, because when you get connected to other people who are like-minded, headed in the same direction, you're going to be able to get the marketing that's not paid for marketing. It's going to be marketing like this, where we are actually making referrals, friend to friend, business professional, business associate to business associate. So thank you so much for joining us today. I appreciate it very much.
Yeah. And again, my pleasure. Thank you very much.
You're welcome. You all take care, lose
Okay.
sickness, find wellness. We'll see you next time.
Okay. Thanks, Beth.